Just a couple of dimensions I want to add. One, you look at it in the healthcare perspective, the whole canvas is part of the preventive, is what you do individually at home or family. Then when you're a little under the weather, you go to a clinic or you go to a doctor, and when something is serious, you go to a hospital. And then when you're out of the hospital, you come home. Last 2-3 years, we've seen some traction in terms of the home health care. But what happens is the space, which is the transition care we're talking about, is completely nascent in India. So that is the one missing piece as far as healthcare canvas is concerned from Indian perspective, and that's where we are very proud to be the first one to start it. The other dimension I want to share with all of you is that I'm sure every one of us has been in hospital sometime or other to visit a family member or to take care of a close family member. The general paradigm in the mindset is that when you go to a hospital, you want to get out as quickly as possible. It's a transaction. You don't want to go back to, it's not a nice place to go and stay there and enjoy the stay. So everybody who goes to a hospital says, how quickly can I get out of the hospital? That's the patient mindset. The second is from a hospital mindset, like Dr. Ramesh was talking about, they gear towards acute care, emergencies. So the moment a patient is deemed to be out of danger, is out of ICU, not on the ventilator, is back in the room, what does the patient and the family member do? 24/7, they're still sitting in the bed or sort of sleeping on the bed, watching TV, nothing else. And in an entire cycle of 24 hours, if you see the amount of time the nurse or a physiotherapist or the doctor actually comes and spends with the patient is probably about 5 minutes. Then it's more of customary, come once in a day, say hello and then move on. So neither is the patient extremely excited to stay in the hospital, nor the hospital looking at its top priority, because for them it's the emergencies, critical care is what is required. So the hospital cannot bring the focus to a patient who is convalescing after a major surgery or a major debilitating disease. Right? In case of transition care, Pendyala Suvitas, what we're trying to do is address these facets. When somebody walks into Suvitas, the environment is extremely friendly, very courteous, and the reason we exist, like what Dr. Ramesh was talking earlier, we don't do any primary diagnostics, we don't do any primary investigations, we don't do any operations, we don't have any ventilators. So the only reason we exist as an entity is because we want to help the patient to convalesce and to recoup as quickly as possible and as in the best possible environment. The other, quick, while it might look like a trivial example to you, yesterday I was in one of the large corporate hospitals to visit a team member who was hospitalized, and when I walked in and spent some time, she said, I'm getting bored, I don't want to watch the TV, I was hoping to read a book. And then it struck me that most tertiary hospitals do not have anything like library.